George Irwin's family ran this Canadian toy company for 3 generations. But when the pandemic hit and borders closed, they pivoted production to make masks with antimicrobial filters, answering the call from Ottawa for Canadian manufacturers to help.
We need a sustainable, stable supply of these products, and that means making them at home.
There was encouragement from the federal government.
But after 3 years and millions of dollars invested, this is what's left of Irwin's factory. He says he's now facing bankruptcy and risks losing his home. Irwin never received a single order from any level of government.
I'm overwhelmed from a sadness point of view. The people that were buying masks went back to their old legacy suppliers, and most of those suppliers were offshore.
One Canadian company that landed the largest medical supply deal of the pandemic is called BTNX. It received about $2 billion from Ottawa for 400 million COVID-19 rapid tests. BTNX is based near Toronto, but its rapid tests are made in China. And so is there any manufacturing done in Canada?
No.
The company's CEO says when the pandemic hit, they found a Chinese manufacturer that was producing rapid tests. After winning the government contract, BTNX purchased this distribution center. The CEO says BTNX's 24 staff mostly handle sales and quality assurance. Manufacturing here, he says, is prohibitively expensive.
We have some packaging capability here, but most of it is done in China.
In its application to Health Canada, BTNX indicated its tests were made in China, but the company's distributors, meanwhile, described the test as engineered and designed in Canada. The company's website and press releases described itself as a Canadian manufacturer, which technically is true. Under Canadian law, if someone imports and sells a medical device under their own name and is responsible for labeling or assigning it to a purpose, they can call themselves a manufacturer.
Companies will tend to call themselves what they feel is going to put them in the best position, in this case, probably to make a sale.
But experts say Ottawa's decision to award the large contract to a company manufacturing in China raises questions about what the government knew or should have known. Federal officials admitted to Global News that before awarding the lucrative contract to BTNX, no one from the government ever visited the company's headquarters. At the time, it was a few small office units inside this business mall in North Toronto, with no manufacturing capacity.
That type of due diligence doesn't take a lot to do, and when it's completely bypassed, there really is no excuse.
Internal emails and communications from federal and provincial health officials revealed confusion, describing BTNX as having made early advances and produced a non-foreign workplace rapid test. Officials with Public Services and Procurement Canada told Global News in the scramble to secure pandemic supplies, they were short on time and options. But other local manufacturers say different.
To be frank, of course, we were hoping for more.
Within months of the pandemic, Cenk Özkan's company was producing nearly 1 million rapid tests per day in Vancouver, creating hundreds of local jobs. Their test performed well and cost less than BTNX's tests, but their contract with Ottawa fell far short of their capacity and expectations.
We were able to do much more even from what the government has requested from us, 3 to 4 times more than what the government was able to grant us.
Overall, only about 6% of the rapid tests purchased by the government were actually Canadian-made. Like George Irwin, the vast majority of manufacturers who produced medical supplies in Canada for the pandemic are now out of business. If another pandemic hits, Ottawa may find them unable or unwilling to help. Jeff Semple, Global News, Toronto.